the impact of the COVID-19 pandemic on people working in the field of public health. Has it wound up attracting more people because there's a recognition that we need people to help? Has it discouraged people from joining? What impact has it had on people joining the medical profession?
It's been truly a biphasic um, course here. That's been, in some respects, the first phase was very encouraging and gratifying. The second phase that we're in now is, I think, and I hope, reversible, but it's disturbing. And let me explain specifically what I mean. In the very beginning, because of the emerging magnitude of the problem, which, as you know, has now resulted in the death of 1,100,000 people in this country, the energy, passion, and commitment that was demonstrated by people involved in healthcare delivery, doctors, nurses, respiratory therapists, as well as public health officials, people who are involved at the local and government, state, and federal level, were really those individuals that stepped to the plate. And there was a swarm of interest in getting involved in every aspect of that. In fact, I was somewhat flattered, though it wasn't just me. A lot of people were doing that. The medical schools were talking about the Fauci effect, namely a lot of people applying, many more people applying to medical school based on the challenge of COVID. It was somewhat similar among public health officials, that everybody was saying, wow, this is really an exciting field. The applications to schools of public health went up dramatically. Then, when the divisiveness in the country made it clear that public health officials, who were essentially espousing well-established fundamental public health principles, were being harassed themselves and their families, the epitome of which is what's happened to me, which, as someone that people, because of my visibility, look up to, they see that I'm constantly getting death threats and constantly getting harassed by myself and my family and my wife and my children. Now there's a pushing back of people saying, hey, do I really want to get into this type of a profession if what I do, even though it is manifestly the appropriate and proper thing to do, that I'm being not only criticized, I'm being harassed. So what I'm hoping is that the biphasic that went up and then come down is going to now start rebounding in the direction when people come to their senses and realize that the public health principles are the thing that made it less than 1,100,000. There would have been many more. I mean, if you look at what the modeling shows, is that if we didn't implement these public health principles, notwithstanding with those who object, that there would have been many more lives lost. So I hope it's going to turn around again. A little bit of a long-winded answer, but it's a complicated issue, and that's why I wanted to explain it more thoroughly.
So just to follow up on that previous answer, what should we be doing as a society, including our lawmakers, to build up the public health workforce again and encourage more people to join?
Yeah. Well, that kind of segues into another issue with regard to public health, is that we have been, over decades, I believe, the victims of our own success in public health. If you go back to the time prior to the widespread use of vaccinations that have diminished dramatically childhood infections and deaths, as well as in adults, we have let the infrastructure of the local public health system have a significant degree of attrition. And what we really do need to do is that all implementation ultimately is local. And we have got to have our ability to accumulate and make available data in real time. That is not the case in this country when it comes to understanding everything from what the isolates are that are circulating, what the impact of an intervention is, what the epidemiological patterns are. I found myself personally in somewhat of an almost embarrassing situation where we needed real-time data as to what was going on. We had to get on Zoom calls with our colleagues in the UK, South Africa, and Israel, because their healthcare system was immediately, intimately interconnected with their public health system. So they could get data literally as it was rolling out. Now, obviously, as you probably heard, the CDC is now taking, and appropriately so, and I commend them for that, a very serious look at the antiquated nature of what they have been dealing with. And I hope over the next few years, as we look forward to the challenge of the potential of another outbreak, whenever that may come, that we do modernize the system, because we really are not up to the level that we should be to face an outbreak the likes of which we're going through right now.
The understanding of the data that we need to ensure that all Americans have access to the information to protect themselves and their health care. And I suppose that's an obstacle holding young people back from joining the public health workforce. Are there others, and what are other strategies that we can use to encourage young people to join the workforce, and where are they having an impact?
Yeah, I think we need to get public health officials at both the government, the state, and the academic level to be out there more trying to articulate the principles of what they're doing. I mean, the idea of being involved in public health, which by definition is public service, I think talking about the importance and the gratification associated with public service is something that I think is very important. In fact, Crystal, that is one of the major reasons why I stepped down in my position as the director of the Institute, because I felt that even though I loved the job and I could stay there till I drop on my desk, whenever that may be, I felt that I wanted to spend a lot more time using the benefit of my experience of 54 years at the NIH and 38 years as the director of the Institute, having had the privilege of being involved in the development of public policy, to try and inspire young people of why that is such a noble and gratifying field. I don't think we articulate that enough. And I think the more we do of that, the more we'll get younger people inspired, which is what I'm going to do over the next few years by my writing and my lecturing, is to get people to appreciate some of the things that we're talking about this morning.
Well, I hope you don't hit your desk for many, many years. Dr. Fauci, if I can squeeze in two more questions, we want to be respectful of your time, but no, thank you. As you know, this is the 20th anniversary of President Bush's emergency plan for AIDS relief, and you played an absolutely critical role in the formulation of that plan. What does the next generation of public health leaders need to know about this program, and what must they do to help us achieve the 2030 goal to end AIDS worldwide?
Yeah, they just need to look at the data, David. The data speaks for itself. I mean, if you look now at the number of lives that have been saved by the PEPFAR program, we all know it's between 20 and 25 million lives globally. That is the most impressive and impactful public health endeavor literally in history, for a single disease. And what people need to know is that regardless of what we're dealing with, we have to support the PEPFAR program, both with the reauthorizations as well as with continuing the resources. I mean, when you have something as successful as that is no time to pull back on it. I mean, it is not only important from a moral, and that's what President Bush, people need to appreciate it, and I say it as often as I possibly can. It was his moral compass that actually allowed this to happen. When he put me and sent me to Africa to go see if we could put this together and what the architect what it was, that's exactly what he told me, that it is our moral responsibility as a rich nation to not have people die because of where they happen to have been born, with the lack of access to the resources that we need for a disease that you can address. And I think if we keep talking about that and articulating it and follow the model of one of the presidents of the United States, I mean, it just really goes to show you what happens when you get that kind of inspired leadership from above, which is really, in my mind, a breathtaking accomplishment.
Last question is a more personal one, and it's about what led you into a career in public health, and what might others learn from your decision-making process and going into this field?
Well, it really started, David, from the time I was a child. My parents had always had a theme in their lives that was an unselfish, not what we can do for ourselves, but what we can give back to society. I think it relates to the fact that my mother and father were first generation immigrants. Their parents were born in Italy and came over for the opportunity in the United States. And it was instilled in them that, we owe society something, let's pay back. And I had that kind of drilled into me subliminally. They weren't explicit about it, but it was very clear the way they lived their lives. I had the benefit of my early education in a Jesuit high school and a Jesuit college, where the theme was service to others. I mean, that was the theme of the college and my high school. It happened to be an all boys and men's school, so it was men for others. When now, since it's has both men and women, it's women and men for others. But I learned that throughout my entire career, and the idea, the feeling of gratification that you get and satisfaction about doing something that would better the lives of another is a feeling that is really incomparable. So that's the thing, again, I try to articulate to younger people, that it's not for everyone. And if you don't do it, that doesn't mean you're not a good person. But if you happen to have some inclination for it, it's really an extraordinary profession. That's how I got into it.